Many of us are still trying to wrap our head around the budget plan that Paul Ryan released yesterday. The plan is called the Path to Prosperity. But as I flip through it, I have to wonder, it's a path to prosperity for whom exactly? For seniors, this budget is no path to prosperity. It is a path to the poorhouse. Instead of Medicare, which provides universal coverage to seniors and only spends 3% of its revenue on overhead, the Republican budget gives seniors vouchers to buy private insurance. Now, you can call it premium support, you can call it a voucher, you can call it a coupon, you can call it the golden ticket if you like, but changing the name won't change the fact that this GOP plan will force America's seniors to hand over most of their incomes to private health insurers. If healthcare costs in the private sector continue to rise as they're projected to, the overwhelming majority of Americans' retirees will be unable to afford health care when Paul Ryan begins distributing his coupons in 2022. The GOP plan would cover just 32% of the cost of health insurance plan, as good as Medicare, leaving seniors on fixed incomes with 68% of the bill. According to the CBO, in 2030, one of Paul Ryan's coupons will be worth about $9,700, and health insurance plans as good as Medicare will cost about $30,000. That means that there will be a bill worth $21,000 sitting in the mailboxes of America's seniors, even though Social Security benefits, which they want to cut, will only be around $32,000 per year for a middle-class senior. The Republican budget means a senior receiving $2,500 in Social Security each month will have to spend about $1,700 of it on private insurance. This plan does nothing to control healthcare costs. It just shifts the burden of rising healthcare costs from the federal government to seniors. Now, I also just like to spend a minute focusing on Medicaid. Many probably assume that the Ryan plan for Medicare is just so awful that it will defeat itself. Meanwhile, Republicans are crossing their fingers, hoping that no one pays attention to the crusade to gut Medicaid. Republicans want to characterize Medicaid as some type of welfare program for freeloaders. It's true that this program serves millions of very poor Americans, children who did not choose to be born into poverty, families with permanently disabled kids, and relatives, and yes, seniors. Medicaid is the largest payer of long-term care for seniors in America. 2/3 of elderly nursing home patients rely solely on Medicaid to pay their care. Where does Paul Ryan propose they go? America should be proud that we don't have poorhouses anymore, and we're not going back to that. Congressman Ryan wants to cut Medicaid when the fact is physicians and hospitals can barely afford to treat these patients as it is because reimbursement rates are so low. And compared to the rest of our healthcare system, Medicaid is cheap. In fact, Medicaid's costs per individual are growing half as fast as Medicare and the private sector. It is true Medicaid is straining the federal budget and state budgets, but treating a symptom of high unemployment won't cure the disease. Medicaid is not too expensive. People are too poor. That's why we should be focusing on creating jobs, raising middle-class incomes, and bringing some economic security back to the American people. I'd like to just close by saying that the Republican budget plan is no work of genius. Claiming government savings by giving seniors a coupon and telling them to fend for themselves in America's dysfunctional private insurance market, or eliminating health care for single moms, impoverished infants, elderly patients in nursing homes, and the permanently disabled is not some new, revolutionary, courageous idea. It is simply an abdication of our responsibility to protect our most vulnerable and the health care that they need, and we are not prepared to do that. Thank you very much.